Miss Gulnera coming from Uzbekistan with a CT scan chest showing a lung lesion. Here in Max Hospital, we did a CT guided biopsy and which came out to be cancerous lesions.
O'tgan yili Max klinikasida mani jiyanim Karimov Sherzod davolanib operatsiya bo'lib ketgan edi. Shu maslahati bilan yuring, o'sha yerga bir sizni ham ko'rsatib kelaman dedi. Shuni jiyanimning gapi bilan bu yoqqa keldim.
We sat and discussed regarding her treatment. It was just carcinoma in situ, where I gave her the options of surgery. Since it was a stage 1 cancer, we investigated her. PET CT was done, CT scan was done, and the biopsy report was reviewed. And there we come to conclusion that the surgery is the best modality for treating her.
Operatsiyagacha ahvolim yaxshi mazida. Og'rirdi, o'pkam og'rirdi, yuragim og'rirdi. Hammanda hayajon bor edi, ham qo'rquv bor edi. Operatsiyadan 1-mart kuni operatsiyaga olishgan bo'lsa, Allohga shukr, mana 10 kun o'tgan bo'lsa.
It's been already 1 week and now she has come for follow-up. We have done a chest X-ray and simple blood investigations. Her chest X-ray shows her left lung expanded and her wounds have also healed.
Shu больницani butunki vrachlariga, jamiki xodimlariga, doktor Bushanga, doktor Vikaska, pulmonolog, kardiolog, hammalariga, kichik xodimlarigacha hammasidan eng katta rahmatimni aytaman. Kattakon rahmat. Sog' bo'lishsin iloyim.
So this patient is now fit to fly back to her own country and lead a normal life.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.